And what I'm very proud of is that we have our younger generation coming in as faculty, and they're going to do all the talking today. So I'd like to invite the first speaker for the session. Before I invite the first speaker, I'd like to invite all the other speakers to come and join me here at the dais at this podium. And the first speaker is Dr. Prajakta Dandekar. Dr. Dandekar has done her Corneal Fellowship at L.V. Prasad Eye Institute, and she's now working as faculty at Shantilal Sanghvi Eye Institute. Her topic is called Blue to the Rescue. So what is this blue and how does it help you in corneal scraping?
Good morning, everyone. So my topic for today is blue to the rescue. So commonly what we use is gram staining and KOH staining. So I'll be demonstrating how trypan blue also can be used, which is commonly available for any general ophthalmologist. So even if you don't have other stains, you can still diagnose many organisms in it. So showing the incidence of microbial keratitis in the world, it is 2.5 to 799 cases per 1 lakh population per year. Out of which UK it is 2.6 to 40.3 and US it is 20 till 27.6. But it is very high in South India and Nepal, where you can see the incidence is 113 in South India per 1 lakh population per year, and in Nepal it is 799. Considering this article given by Tin et al. Showing the most common organism in the region, we see that out of in America, Europe, and some Asian countries, the organism is bacteria, but in India it is fusarium and aspergillus. That is, fungal organisms are more common in our country. This is another article by Charles et al. Showing how fungal keratitis is double that of the bacterial keratitis. Considering this article by Aftab et al., it shows how trauma with vegetative matter is the most common cause of fungal keratitis in our country, and fusarium was a common isolate when the study was conducted in eastern India. This is an article demonstrating how India is the highest for acanthamoeba incidence is highest in India when the study was conducted global, considering the global epidemiology. Out of which when acanthamoeba cases, they are more contact lens related in other parts of the world. In our country, it is non-contact related acanthamoeba which takes higher prevalence. This is a review article showing Pythium keratitis review, which says that the tropical and subtropical climate like Thailand and in our country, the incidence is more. And the incidence has been shown high in bathing in ponds because of bathing in ponds and agriculture related causes, trauma. So these three organisms like fungi, acanthamoeba and Pythium, which are very predominantly a cause of keratitis in India, this can easily be diagnosed in trypan blue stain is what we are going to demonstrate. So considering these three keratitis pictures, the clinical diagnosis becomes difficult. So that is what the importance of corneal scraping is. So this is an article in which they demonstrated how clinical diagnosis can fail, and because of multiple antimicrobial use also, we are not able to locate clinically what the organism is. So these are different incidents of keratitis in which the clinical predictivity was not very great. Then demonstrating the characteristic features of fungi like serrated margins, dry slough, dry looking ulcer, satellite lesions, which is also, there are also cases reported in which the similar features were present in bacterial keratitis. So again, it is not very specific for fungi. So coming to trypan blue dye, which is used for anterior segment surgeons. For us, we use it for staining the anterior capsule, side ports, main port, also for staining the DM in PK, DALC and DMEC, DSEC cases. And also sometimes it is used by glaucoma surgeons to confirm the patency of drainage blips and tubes. In posterior segment surgery also it was rampantly used for staining the ERM and ILM peeling surgeries. For the first time, Pawan Prashar et al. Demonstrated how KOH and trypan blue, how they can be differentiating the fungal keratitis. So in KOH, he has compared the picture of KOH with that of the trypan blue stained fungi and demonstrated how easily we can pick up the fungi as compared to the KOH, where because of the high line kind of a staining, it is not very prominently picked up. So this is an article by Sharma et al. And group in which they demonstrated even trypan blue can easily differentiate septate and aseptate hyphal filaments, which differentiates it from easily from pythium and fungal keratitis. So this is an article by Dr. Somshila and Varsharati group, in which they have compared the trypan blue stain with KOH and chalcofluoride white staining. So they have also demonstrated that it is equally, like the specificity and sensitivity is comparable to each other. And this is a picture showing when the trypan blue was mixed with KOH, it was forming some clumps. And when it is mixed with glycerol, it forms a smooth emulsion, so in which the organism can be easily picked up. So they have recommended trypan blue along with glycerol. The sensitivity again, which was compared with the gold standard, is shown to be comparable with that of the gold standard, even the culture and KOH, chalcofluoride white. So these are the videos. The video is not playing, I'll play it at the end. So showing the trypan blue staining, how it is prepared. So 3 ml of 0.06% trypan blue can be mixed with 0.5 ml of glycerol, and it can be, this stain can be used for another 3 days. So normally these are the prerequisites when we take corneal scraping. You have to also assess, you have to keep some slides, then chocolate agar, blood agar, NNA, SDA, PDA, and one liquid media which we used is BHI, brain heart infusion drug. And so paracaine will be used first. There is a marker also placed here, and 15 number blade is the one which we use commonly. So cyanoacrylate glue and BCL also should be kept ready in case if the cornea is very thin. So points to remember for corneal scraping are preferably the medication should be stopped at least 24 hours before scraping. A slit lamp picture or a diagram should be made. The areas of thinning or perforation should be noted before you start scraping. Use dim and diffuse light so that the patient is very comfortable. And the scraping is recommended to be done from the edge and base of the ulcer, because that is the area where you can find the organism. Then keep the lashes away from the blade to avoid contamination. So this is how we label the slide. There are a few videos also, I'll demonstrate it at the end. The marking has to be done behind the slide, and you also name the laterality and patient's number or name. And these are the C-shaped streaks which help us to differentiate between contamination and the growth. So any growth which is present in these C streaks is considered, should be taken as significant. So this is a light microscope versus the fluorescence microscope. So light microscope is used for for trypan blue staining, and fluorescence microscope for KOH and CFW staining. So I'll demonstrate few cases in which we found these organisms. So this is a case number 1, 16 years old male patient who is a student who was referred to us for corneal scraping. There was no history of contact lens trauma or steroid use. And the patient had this 6 into 5.5 mm corneal epithelial defect with infiltrate with a streak hypopyon, which is not actually visible in this picture. So it was a dry looking infiltrate with some feathery edges, and you can see there is some kind of a picture like dendrite also in between. And we scrape this lesion, and this is a demonstration in trypan blue staining, which is showing septate fungal filaments. So we started the patient on antifungals, and patient is still on follow-up. This is a demo. This is the next patient, 55 years old male from Thane. So he came with a history of trauma with the fingernail. He was unable to remove the contact lens from the eye, which was already removed. So he had a trauma with the nail. Later on, the patient had some patching done at the local ophthalmologist, and there was some antibiotics mixed with sterile water which was given. When the patient came to us, the vision was CF, PR was accurate, and the right eye, the patient had a lesion of 2 into 2 millimeters with epithelial defect with 2 mm of hypopyon.
So Prajakta, maybe you can just show the positive slide,
Yes.
and then go on to the videos, because you're out of time actually.
Yes, okay.
So you can just show us the slides instead of this also,
yes.
and then go to the videos.
Okay. So this is a clinical picture of acanthamoeba patient, and this was how the trypan blue demonstrated acanthamoeba. And this is the latest picture in which the patient has been responding. This is a case number 3 in which the patient had.
You can maybe just go to the videos.
Yes. Okay.
videos from her laptop.
So this is the demonstration of trypan blue staining, in which 3 ml of trypan blue is mixed with you just place it 1 drop of it and put cover slip on it, and it is seen under 40x magnification. This video is available online. It is along with the article given by Varsha Rathi et al. Just 1 cover slip is placed on the top of it and you can see it under the light microscope. Then it's not clean. So this is a slide in which the gram staining is being done. The circle which is marked is behind the slide, and a very smooth smear, a very thin smear has to be made for gram staining and trypan blue staining as well. The process is the same. And this is a demonstration of corneal scraping, how it is taken at the edges and the base of the ulcer. It is better to do it unidirectional to avoid some loss of material. And this is a C-streak demonstration of in any kind of agar plate. So these are the different organisms, fungal, pythium and acanthamoeba, which can be easily seen versus KOH. These are my acknowledgements. Thank you.